think it's going. All right. Well, welcome to this informational session for the Master of Applied Arts and Health, an Ohio online program. And I'm Dr. Sharon Boyle, and I will just jump to what we're going to talk about today. We'll have some welcome moments for introductions with our enrollment team, and I'll talk a little bit about the Master of Applied Arts and Health program, different career options, the application process, and provide opportunities for a Q&A that you can put in the chat at any time, and then provide our contact information. All right, so as I said, I'm Dr. Sharon Boyle, and I'm an associate professor of music therapy and the director of arts and health. So I have been a board certified music therapist for approximately 28 years, and I've worked clinically in a variety of healthcare settings, from day programs to county facilities to hospital settings and psychiatric care. And I'm in my 24th year as a music therapy educator, and I teach in the Ohio University Graduate Music Therapy Program, in addition to being the program director for the Applied Arts and Health program. And I also have a doctorate in health sciences, and I'm really interested in the role of the arts in our health and well-being, both clinically and non-clinically. I published and presented on a range of topics under the arts and health umbrella. And in addition to me, we're also happy to have an agreement with the Cleveland Clinic Arts and Medicine area. And Dr. Lisa Gallagher, who is the research manager there, also serves as an adjunct instructor for the Master of Applied Arts and Health program. I'd also want to take a moment to introduce the enrollment team that we have here today. We have Elizabeth Driscoll-Dewitt and Sohee Yuk, and we also have Tara Butler, but she's not able to join us right now. But would either of you like to say anything about your role as an enrollment team member?
Just like to say hello to everybody and welcome and thank you for your interest. I know that we are excited to support you as you endeavor upon this journey and start to explore the program and have questions about the application process. We are here to support you with that. So we look forward to working with you.
Wonderful. All right, thank you. On to our next. All right. Well, I would like to start with just talking about what arts and health is and how it differs from the creative arts therapies. Arts and health professionals have been working in a variety of healthcare settings, I think, for many years, but they're now moving to become and professionalize. And so they're moving to gain more information about these healthcare settings that they may not have had exposure to in their fine arts education. So really, arts and health professionals are professionals in specific arts disciplines. So it might be a visual artist, it could be a theater artist or actor, director, it could be someone in film, it could be an artist in music or dance. So it's very much an interdisciplinary art experience. And these experts in their arts discipline may have interest in moving into the healthcare environment and being part of preventive care or changing environments in healthcare settings to make bring beauty into those spaces and to bring comfort and help connect people in ways that they may not in other situations. So an arts and health professional who might be interested in a hospital setting may end up working in those spaces where you don't have a lot of other supports maybe in place, such as waiting rooms or discharge spaces where people are just in this kind of liminal space of waiting or might be processing information or being a little anxious or concerned about what is to come. So arts and health professionals can be in those spaces and provide arts experiences for people either to engage in or to experience just within their environment. And in larger hospital systems, they may have even art curators where people create and bring art into the spaces. So not just your standard print that you buy at a Costco, you actually have actual art collections and opportunities for people to find their way around a hospital using place finders or map finders, which are actually like sculptures or art pieces. And they can be points of discussion or people get their picture taken in front of them. And it actually can create a whole different experience for people when they step into those spaces versus the traditional stark white walled just kind of general typical hospital environment that you might think of in maybe in your childhood. So there's definitely a movement to try and change those spaces and bring beauty into the spaces, because we know that research really helps is supporting the idea that being engaged in the arts and being exposed to beauty and the arts around us actually benefits our health and well-being. So I just wanted to give a little bit of clarification there. Creative arts therapists work clinically, and so they work oftentimes with the most vulnerable patients and people who have really specific treatment goals. And so they're trained and educated to use the art form to address clinical goals, whereas arts and health professionals are working non-clinically, but they might collaborate with them in different contexts within a medical environment or in the community healthcare environment or even public health spaces. All right, so our program is basically responding to this professionalization movement, and it's a new program that began this year. We launched our first cohort in the fall of 2024, and it's really working to develop an understanding about the intersection of how the arts move into healthcare and really engaging all of these visual and performing artists into these settings of public health, community, and medical settings. The program is a 30 credit asynchronous online course based program. There are some on the ground hours that people might get in one of the courses, a community project course that's a full semester. And there's also a professional internship that I'll talk about in just a few moments that also requires on the ground work. However, all of these can take place wherever you might be. So if we really want to develop the communities and the spaces within your own kind of sphere. And since we're an online program, we work with people across Ohio and other areas. The cohort model means that even though it's an online asynchronous program, that you should have some connection with the same people as you're moving through the arts and health course sequence. And this provides hopefully a little more support, a sense of community, even in the online realm, and that you have people that you can kind of also witness their growth just as they witness yours. And it can be an opportunity to have relationships that develop beyond the program. So you can actually enroll, though, either in fall, spring, or summer. And you also can have a choice of a 1-year track or a 2-year track. And as I've said, it's interdisciplinary, so you get to learn from people in other arts disciplines and learn about their experiences and their backgrounds. A lot of times the students that are looking at our program have a very long, robust background in their art, and they may have already done some work in the community. And it's really great to learn from each other and learn from peers as well as the coursework that is developed for you. So as I mentioned, we have some on-the-ground hours, which include a community project course, and that is volunteer hours that you get working in an arts-based program and then a non-arts-based program. And through those experiences, you develop a proposal for an arts and health intervention, and you learn the process of how to do that, but using that real life experience and engaging with actual programs and figuring out how the arts might intersect in those non-arts based programs. And that's a really great opportunity. The other thing is at the end of all the coursework, you have a professional internship that has a culminating project that's really geared toward the student interest and a setting that they might be interested in. Right now, we have students who are setting up internships for this summer, and some of those might be in children's hospitals. There's one that's probably going to be in a community center working with adults with intellectual and developmental disabilities. Another one has a similar but art studio community-based program that'll be combined with the community health program at Ohio University. So there's a lot of options and diversity just based on people's backgrounds, experiences, and location. So those internship hours have a minimum of 180 that are required on the ground, and the way that you can do the schedule is really flexible and adaptable based on the student needs and also how the site can accommodate it. And I work with the student as we start setting up those internships to kind of help support them finding the right placement and helping to communicate all the facets of the internship so that they get the experience that really benefits them as they move toward the end of the program. I will mention that our program is eligible for the Ohio Incentive Scholarship. And I don't know if anyone in the enrollment team would like to say anything else about how you qualify for that.
Absolutely, yeah. This scholarship is a great opportunity. It is a 15% reduction in tuition. There are three ways in which students would qualify. One would be being an alumnus of the University of Ohio University. Also, if you are employed by one of our corporate partners, you would be eligible. Or the third way would be if you were an active or veteran military member.
Thank you so much, Elizabeth. Appreciate that. Something else that you get to participate in as a part of this graduate program is the Rise Smart Partnership and Strategic Career Support Program. This allows you to have individual career coaching. They have a branding expert that can work with you. There's a career concierge. They have a 24/7 career toolkit and resources available. They provide webinars on a regular basis. You can meet individually with people. It's a really great opportunity, and it gives you access to all kinds of networking things related to job searches and working with you toward your goals for your career. As I mentioned, there's a part-time option and there's a full-time option. The part-time option is for those who are starting in the spring semester. You're automatically kind of moved into a 2-year sequence. You complete all your coursework prior to doing the internship in the summer. And so you can choose to start in the fall as well as a 2-year track. People do that for a variety of reasons. Might be you might work full time and can only manage a couple courses at a time. That's completely fine. Financially, it might work better for you to do a couple courses at a time. So we provide that option. But the only thing is, if you do a 2-year program, you still move as a cohort through those arts and health courses in a sequence. So you do those in the same way as everybody else, and then you might do your elective courses in the second year. If you're doing the full-time option, it's what we call an accelerated program. So you're gonna you can start in the summer or start in the fall, but you basically will take health sciences electives that we have as part of the requirements, along with the arts and health courses. So the way it's set up is that we have a lot of 7-week online courses that you have in session A and session B. So in the first session of the fall semester, you would do an intro to arts and health while you're also concurrently taking a 7-week health sciences elective course. And then in the second half of the semester, you could take the arts and health course, and then at the same time take another health sciences elective. So you can kind of stack those courses, do 2 at a time, 7 weeks, the next 2 the second half of the semester, and then move into the spring. So hopefully you can see this okay, but it's just a way to kind of look at how those courses stack up if you're going to do the full-time 1-year option. So again, you have the fall semester. You're going to take the intro class with the health sciences elective at the same time, and then the artists in healthcare and other health sciences elective. So 4 courses in the fall semester. As you move into the spring, the community project arts and health class is a full semester to get those volunteer hours in and work on those different kinds of proposals that I talked about. And then at the same time, you'll have a 7-week course on the first half of the semester, which is an elective fine arts course. And then the second half of the semester, you'll do the special topics in arts and health class. And then it culminates in that internship in the summer. And below here is just a little bit of a chart to kind of lay out how the credits lay out with the different courses. This can be found on our website as well. And there's also options for people who may be a graduate student who's already on campus in person. If they're doing a graduate program, they can also add the 1-year Master of Applied Arts and Health program as well. So we also have a graduate arts and health certificate. So if you are already in a graduate program and you don't know that you can manage another master's program, you could do the graduate certificate, and several people have done that. It's basically 12 credits, and 2 of the courses are 2 of the arts and health courses, and then 2 elective courses. So as you can see on the screen here, you could do it in basically 1 year. You could do the Intro to Arts and Health course along with the Health Sciences elective the first half of the fall semester, or if you want, you can spread out the elective into the second half of the semester and do 1 course at a time. There's lots of options. And there also might be an elective available in the summer session as well. Oftentimes people are wondering what kinds of job titles, what kinds of career options are there with arts and health. These are a list of some job titles that I have pulled from actual job listings. I think it gives you a perspective of what is out there. Sometimes you might see artist in residence, and you can see that in a school environment, but you can also see artist in residence in a hospital environment or even a community program. And a manager of arts and health and well-being with a master's degree, this program really helps poise someone to maybe move into administration or management or even a director position if they are so inclined. You can also have a title like an arts education specialist if you're really interested in working with children or working in school programs or after school programs or special arts education community programs. Arts impact program director, arts wellness program facilitator, arts and health specialist, community arts facilitator, or even a teaching artist. So these are just some job titles that you might see that align really well with the curriculum of this program. So the admission requirements that we have is a bachelor's degree in fine arts from a regionally accredited U.S. college or university or its equivalent. Ideally, it could be in music, dance, visual arts, or any fine arts. But you may have had a lifetime of arts experience that is comparable to what an undergraduate degree would have brought you. So if you have an undergraduate degree in another area, you could still be eligible, but your portfolio that you submit or your audition video or whatever area you're in would matter a great deal because we're going to be basing it on the level of your artistic output and see where you're at so that you're at the graduate expectations. And I also have a committee that helps me review those portfolios. The official transcripts that need to come from your other institutions, and it should be a 3.0 GPA or higher, and you submit that with your online application. In addition, you will submit a resume, or if you have teaching experience, it might be a curriculum vitae. And it kind of gives a wide range of your background, your education experiences, work experience, any teaching you may have done, or even research. It's not required. It just gives me a picture of who you are and what experiences you've had. If you've been part of any professional affiliations or other groups, any community volunteer experience, and even publications if you happen to have them. So basically, you're just sharing the depth and breadth of your experiences with the admissions committee. In addition, you'll have a letter of interest or a personal statement, and we want you to include background in your art discipline. Tell us about that journey, and help me and the admissions committee really see that this has led you to a specific interest in this program and what your professional goals might be. That's very helpful as I may support and help guide you in different directions throughout the program if I know what your goals are. And another thing that you can include in that statement is if in your location, in your geographic area, if there's some potential internship sites or even on-site supervisors that might be really helpful to work with in your area when you get to that point. I would say that internship supervisors would be creative arts therapists potentially, or people who have worked with arts and community programs before and have a good understanding of the roles that you might have as an arts and health professional. And if you don't quite know who that would be, then we can talk about that as we move forward. The other important piece is that arts-based submission, the portfolio. So typically you would just reach out to me as part of the enrollment process and let me know what your background is, and I will let you know more specifically what's required for your portfolio. If you're a musician or an actor, you likely are going to have, or a dancer, you're going to likely have a video audition, and I can give you specific parameters of what that would entail. And if you're a visual artist, you would submit an art portfolio, so typically 15 to 20 pieces of art, including the titles and an artist statement to give us a sense of your art, the expansiveness of your art background. And then it also helps us understand your skill in your artistic discipline. So, in addition, you also have at least 2 letters of recommendation are required. They can be from a wide range of individuals. It can be former employers, instructors, or people who would have had a really good view or perspective of your professional or academic experiences. You also can check the English proficiency requirements for the university as part of this, and there is a $50 application fee associated with submitting the application. I will say that you can turn in pieces of the application over time once you get into the portal, and the enrollment advisors are here. They can always answer any questions, and they are there to help you kind of move through each of those steps. I will say, though, that if you're interested in applying, request those recommendation letters and get those official transcripts ordered as soon as possible, because those take the longest time to come through. And then also, working on that resume, personal statement, and portfolio concurrently is a really good way to go. So you kind of have it all as a cohesive package. The deadline's coming up for the arts and health programs for the summer and for the fall semester are here on the screen. April 14th is the deadline for enrollment in the summer semester, and August 4th is the deadline for the fall 2025 semester. All right, are there any other questions that maybe the enrollment team has had before that they want to bring up here that I can answer? If not, I will say that you can always reach out if there's a question. I have my contact information here. You can reach me directly. I'm pretty consistent with my email. I can get back to you pretty quickly. We also have the email here, onlinegrad@ohio.edu, for the Ohio Online connection. And then we also have social media, so feel free to follow us on Facebook or on Instagram, because I post things very regularly related to arts and health and arts experiences and things that might be related throughout the university and community at large. And then I also share information about our program and our faculty and our students. So please do not hesitate to reach out if you have any questions for me. And I think that will do for today. I really appreciate your time and your attention. And please do not hesitate to let me know if there's anything I can do to answer any questions you have down the road.